Imagine greeting each day, not with eagerness and energy, but with a heaviness in your joints, a stiffness that refuses to fade after a good night's sleep. You move gingerly, calculating every step, conscious of the lingering ache that shadows even the simplest tasks. Determined to feel better, you've embraced a diet rich in vegetables, loading your plate with colorful salads and wholesome greens. But what if, despite your best efforts, some of those healthy choices are actually contributing to your pain? It's a revelation that surprises many. The very vegetables we trust to nourish our bodies can sometimes work against us. The world of nutrition is complex, and while vegetables are undeniably packed with essential nutrients, they also contain compounds that for some people can trigger inflammation, especially in vulnerable joints. Understanding this hidden connection may hold the key to unlocking a new level of comfort and vitality in your daily life. Let's delve into 3 of the most common vegetables that can act as stealthy saboteurs when it comes to joint health. First, consider the nightshade family. Tomatoes, potatoes, eggplants, and bell peppers are staples in kitchens around the globe, prized for their flavor and versatility. Yet nightshades contain alkaloids, like solanine, that can provoke an inflammatory response in certain individuals. If you notice increased joint pain after enjoying a tomato-rich pasta sauce or a serving of roasted potatoes, you might be sensitive to these compounds. It's not an allergy in the classic sense, but rather an intolerance that quietly fuels discomfort. Next, there's corn, a ubiquitous presence in modern diets, found not only on the cob, but also in countless processed foods, snacks, and sweeteners. Corn is high in omega-6 fatty acids, which, when consumed in excess relative to omega-3s, can tip the body's delicate balance toward inflammation. For people dealing with chronic joint issues or inflammatory conditions, this imbalance can be especially problematic. Even foods marketed as healthy, like whole-grain corn chips or popcorn, may exacerbate symptoms if consumed frequently. Spinach and other high-oxalate greens present another challenge. These leafy vegetables are celebrated for their dense nutrient profile, but they also contain significant amounts of oxalates, naturally occurring compounds that in susceptible individuals can contribute to the formation of crystals in the body, sometimes settling in the joints. This can lead to episodes of pain that mimic or aggravate existing joint issues. For those with a predisposition to kidney stones or a family history of oxalate sensitivity, this is an important consideration. Medical experts emphasize that uncovering the relationship between diet and inflammation requires a personalized approach. Dr. Eleanor Vance, a respected rheumatologist, points out that many patients are surprised by how much control they have over their symptoms once they begin to track and adjust their eating habits. It's about listening to your body, she explains. Elimination diets and food journals can be powerful tools in identifying hidden triggers. The goal isn't to create fear around food, but to empower people with knowledge. If you suspect your salad bowl might be contributing to your discomfort, consider experimenting with alternatives. Swap nightshades for non-starchy vegetables like zucchini or carrots. Replace corn-based products with options made from quinoa or brown rice. Try rotating your greens, opting for arugula, kale, or romaine instead of spinach. These small adjustments can make a noticeable difference, reducing inflammation and restoring ease of movement. Ultimately, the path to lasting joint comfort may not lie in adding more to your routine, but in removing the unexpected obstacles hiding in plain sight. By becoming an informed, mindful eater, you can reclaim your mornings, move freely, and rediscover the joy of living without pain. The journey starts with a single, thoughtful choice, one that could transform not just your plate, but your entire outlook on health and well-being.